The mental health affiliation that we are looking at, both organizations are looking at, really came about with Senator Robinson, who was concerned about their director leaving due to retirement. And then our organization was also up there talking about the ongoing need for administrative funding for our organizations. And so he really came up with this idea that maybe these are two organizations who have very complementary missions could really work together in a way that would be kind of unique and look at sharing some administration. And so that's how we came up with our administrative affiliation. Well, I think what it's going to look like is that it will actually be more coordinated, in that both organizations will work very hard at coordinating the voice and what some of the messages are, what the priorities are. So we'll be really speaking with a unified voice, really around those policy issues. Oh, certainly. I don't know if I can go into all of them or whatever off the top, but our top priority is really around peer support, peer and family support. And it's really looking at an individual with lived experience partnering and providing those services, support services for another individual that has mental health needs. And the children's version of that would be a parent to a parent to really help with them going through the system and seeing what it is that they need help with and just kind of helping them with their journey. And it really has been shown to, there's evidence behind that people actually do a lot better in their recovery when they are paired up with a peer. I would say on a whole, it really is around access to services and the amount of services that are available. I have talked today about the numbers that we have, and yet the planning is done for such fewer numbers of kids. And so you can kind of take a look at maybe how many are the Department of Human Services serving compared to what that need is out there. So we've got a lot of people. Nationally and statistically, we have 2/3 of individuals that have an identified mental health issue going without treatment and going without help. And then they end up into, and we've highlighted the diversion that we want, but they're ending up in our juvenile corrections systems and our prisons. And we need to stop that and really get people the treatment that they need.